Camera A speeds.
Camera B speeds.
Okay, go ahead and introduce yourself, Dr. McCulloh.
I'm Dr. Peter McCulloh.
Great, and go ahead when you're ready and take a beat and start.
Dr. McCulloh, what is contrast-induced acute kidney injury?
This is a problem where when doctors use contrast dye.
Sorry to stop you. We're going to go right from the beginning. This is my fault. Can we make an active effort to incorporate the question?
Oh, because the question is going to be edited out. Oh, yeah.
So
I got
contrast-induced
it. Sorry about
So
that.
we'll go right again from the top.
Thanks.
Okay.
And then take a beat and start again.
Dr. McCulloh, what is contrast-induced acute kidney injury?
Contrast-induced acute kidney injury is a complication when doctors use contrast dye, which helps them see blood vessels on x-rays more clearly, when that dye injures the kidneys.
And why is contrast-induced acute kidney injury important?
Well, as doctors are trying to get better pictures in the human body and open up blood vessels and provide treatment, the contrast, because it can damage the kidneys, actually undoes a lot of the good that doctors are attempting to do with their procedures.
What role does catalytic iron and oxidative stress play in contrast-induced acute kidney injury?
It's recently been learned that when the kidney cells are damaged by contrast, they release tiny amounts of free iron. This free iron then drives biochemical reactions that damage adjacent cells. So in order to reduce this process, there are new treatments.
And what role does catalytic iron and oxidative stress play in cardiovascular disease?
We believe the role of catalytic iron may be quite broad. Recently, it's been shown that catalytic iron is part of the damage that occurs with heart attacks, the damage that occurs with kidney injury, and perhaps other organ injury syndromes.
Okay, is that the final question?
That's the final question.
Okay, let's cut for a second.
Do you want to do
Cut
one more?
cameras. Camera A speeds.
Camera B speeds.
And Dr. McCullough, if you give me one more clap in front of your face would be great.
Peter McCullough.
Thank you. Go ahead.
Dr. McCulloh, what is contrast-induced acute kidney injury?
Contrast-induced acute kidney injury is a common complication when contrast is used by doctors and injected into the bloodstream in order to do various cardiac and radiology procedures.
And why is contrast-induced acute kidney injury important?
Contrast-induced acute kidney injury is important because as doctors are working to try to improve other areas in the body, including the heart and blood vessels, the contrast damages the kidneys as a side effect, and this damage to the kidneys can later translate into very serious outcomes, including ending up on dialysis or even death.
And what role does catalytic iron and oxidative stress play in contrast-induced acute kidney injury?
It's recently been discovered that when contrast damages tissues, particularly the kidney cells release tiny amounts of catalytic or free iron. This free iron then provides the basis for biochemical reactions that cause further damage to the cells and tissues. So catalytic iron is very important because new drugs are being developed to bind catalytic iron and reduce the rates of organ damage.
And what role does catalytic iron and oxidative stress play in cardiovascular disease?
The role of catalytic iron and oxidative stress in cardiovascular disease is enormously important. We believe that not only in the heart, the kidneys, brain, and potentially other vital organs, as there is a chronic as well as acute episodes of injury, oftentimes due to a lack of blood flow or a toxic agent being administered to an individual, that once cells release catalytic iron, the catalytic iron then fuels oxidative stress reactions and the generation of the dangerous hydrogen peroxide and hydroxyl radical. Those entities then cause cell-to-cell death, much like one would see the development of a brown area in a bruised apple.
We'll cut camera A speeds.
Camera B speeds.
This is Dr. McCullough, take 3. If you give me one more clap.
Peter McCullough.
Could you actually give me one more clap again, just a little louder? Thank you very much.
Dr. McCullough, what therapies are currently available for contrast induced acute kidney injury?
Unfortunately, there are no approved therapies to prevent acute contrast-induced kidney injury. However, in 2010, it's been a landmark year where I have started, as a principal investigator, a prospective randomized trial of a definitive new agent, deferoprone, which is a catalytic iron or free iron chelator in the prevention of contrast-induced acute kidney injury. I believe this trial will be a landmark trial in that it's the first attempt with a drug that is currently under the scrutiny of the FDA to reduce the rates of injury to the kidneys and hopefully translate into improved outcomes for patients.
You like the answer?
Sorry, I didn't say
Feel good about it?
No, that's good, that was great.
You feel good about everything? Okay, I feel good about everything.
I feel great.
Okay.
Do you need room tone again or
Do you want room tone?
This is room tone for Dr. McCulloh.